Welcome back to The Fight. I'm Alex Wilcox. Dr. Greg Hendey is a 1985 Notre Dame grad who currently serves as the chair of emergency medicine at UCLA. In the week of the COVID crisis, he's been working around the clock to plan and implement UCLA's hospital's response. Dr. Hendey, welcome to the show. Thanks for joining us.
Hi, Alex. Thank you.
Now, being in emergency medicine obviously puts you right on the front lines. So tell us, what does this crisis look like from your perspective?
Well, we started with a lot of uncertainty about just how big this pandemic would become. But one thing we knew for sure was that the emergency department would be the tip of the spear. So we spent hundreds of hours planning on how to keep our patients and our staff safe. So fortunately, UCLA was pretty well prepared. We had lots of supplies and we had a disaster plan all ready to activate. So we mobilized quickly and we created a lot of capacity to handle a huge surge of patients, which fortunately did not happen. From the moment a patient arrives in the ED, even before entering the building, we do a COVID risk assessment and we mask everybody. And we separate those with COVID-like symptoms, fever and cough and so on, so that we can safely care for them in one part of the ED while not exposing our other patients, many of whom are immunocompromised. And we wear PPE, or personal protective equipment, mask, face shield, gown and gloves throughout the ED at all times.
Right.
We basically changed and retooled everything that we did, from registration to where we see patients, to how we do x-rays and ultrasound, to the discharge process, all in an effort to reduce exposures and keep our patients and staff safe.
Now, how many COVID-19 patients have you seen come through your doors?
Well, I can't give you the exact number, but we've seen a lot of patients with COVID, and even more that were worried that they had COVID. Half of the COVID cases in California are in LA County. So we see COVID patients every day in the ED. And while some are very sick and require oxygen and even need ICU care, most of them don't need to be hospitalized and can actually be discharged to recover at home, just like other viral illnesses. We've had to make changes in pretty much everything we do in the ED in order to minimize exposures for the staff and the other patients. But at the same time, we still need to take care of all of our usual patients with a broken arm or a heart attack or abdominal pain. So I would say our biggest operational change has been to require PPE in the ED for every single patient interaction and to cohort or group the high suspicion COVID patients into one area, separating them from the rest. So that includes doing an initial triage assessment outside in a tent before they come in, and then seeing those patients in a series of cubicles with strict infection control and full PPE. And again, most of those patients can be tested and reassured and released.
Doctor, we've seen so much negative news about this coronavirus, tens of thousands of deaths, millions infected. But I'm curious, can you share with us some encouraging moments or interactions that have given you hope during these obviously very difficult times?
Yeah, one of the really great things that happened to us was a local group of business people and restaurant owners in LA came together in a campaign that they called Feed the ER. And they're basically bringing lunch and dinner for the entire emergency department staff to two of our UCLA hospitals in Westwood and Santa Monica for 2 solid months. So that's pretty amazing. Also, I got to do a couple of really neat things at the end of April. Like Coach Bray said, we've all become Zoom ninjas, and I've spent way too many hours on Zoom in the past 2 months. But on my birthday, which was April 29th, 29 years old again, right? We had a Zoom birthday party with family all over the country, which was really cool. The cake doesn't taste quite as good, but at least it has no calories. Also, when I was at Notre Dame, I was a bartender at Senior Bar, and that was back when it was run by students. And then on April 30th, we had a Zoom reunion for all the bartenders, some of whom I have not seen for 35 years, but it was actually really great. And interestingly, you'll be happy to know we all look exactly the same. None of us have gained any weight or lost any hair. But that was a really special time at Notre Dame, and with a really great group of people.
Dr. Hendey, thank you so much for joining us and, of course, for all you're doing during this pandemic. And a belated happy birthday to you.
Thank you, Alex, and go Irish.
Go Irish.